Assalamualaikum and good morning to one and all. Today we'll study about part 2 of Autocoids. At the end of this e-learning session, you are able to discuss pharmacological action of histamine, explain its pathological role, classify anti-histaminergic drug. So let's start with pharmacological action of the histamine. So first action we'll study, it is the action on the blood vessels. So remember that the action on the blood vessel, it is depending upon the size of the blood vessel and also the route of administration of the histamine. Let's see what is effect of the histamine based on the size of blood vessel. So you can see here, in case of the smaller blood vessel, so those blood vessels which are small. So what do you mean by smaller blood vessel? So the larger blood vessels are the veins and arteries, whereas smaller blood vessels are the arterioles and venules and capillaries. So in case of smaller blood vessel, histamine, it produces the dilatation, right? So it produces the dilatation of the smaller blood vessel, whereas in case of larger arteries and the veins, so arteries and the veins are the larger blood vessels, there histamine, it produces exactly opposite action. So instead of dilatation of the blood vessel, the histamine, it produces the constriction in case of the larger arteries and the vein. So based on the size of the blood vessel, smaller blood vessel, histamine produces dilatation, whereas in case of larger arteries and veins, the histamine, it produces the constriction of those blood vessels. So this is the action of the histamine based on the size of the blood vessel. Now let's see what is the action of the histamine based on the route of administration of the histamine. For example, when you give the subcutaneous injection of the histamine, it produces the flushing. So the flushing, it is a response, it is seen when there is more supply of the blood to the skin, isn't it? So when there is more blood supply, it produces the flushing. So when you give subcutaneous injection, it produces the flushing. It increases the heart rate and cardiac output with little or no fall in the blood pressure. Ideally, what should happen when there is increase in heart rate and cardiac output? So what happens due to this? There will be more blood pump into the blood vessel. As a result of that, ideally it should increases the BP, that is blood pressure. But here, although it increases the heart rate and the cardiac output, so this increase in the heart rate and cardiac output, it is not to the extent where it can increases the blood pressure. So it doesn't produces much effect on the blood pressure, or sometimes there is no effect it is seen on the blood pressure of the patient. So this is about subcutaneous injection. Let's see what happens when you give rapid IV injection. It means you are directly giving in bolus dose of the histamine through the intravenous route. So in such case, rapid IV injection, it causes fall in a blood pressure. So there is a decrease in a blood pressure. So this is the first effect. In addition to this, it also produces increase in capillary permeability. So there is increase in capillary permeability, and it is very obvious because when you give the histamine and in the smaller blood vessel like the capillaries, venules, what it produces the dilatation. So due to dilatation of these blood vessels, there will be the dilatation of the capillaries, right? So there is increase in the pore size of the capillary, which increases the permeability of this blood vessel. It means those protein which are present in the blood, like globulins, albumins, which are not supposed to pass through the capillary due to their small size, now they can easily pass through the capillary due to dilatation of their blood vessel. Okay, so due to increase in dilatation, it produces increase in capillary permeability. So these are the effect on rapid IV injection. It causes fall in the blood pressure and increase in capillary permeability. Let's see what is the effect on the heart. So effect on the heart, it is studied with the guinea pig. So the heart from the guinea pig was isolated and their effect was studied. So injection of the histamine, it is directly given into the heart after its isolation. So after giving the injection of the histamine, it is observed that both rate as well as the force of contraction. Okay, so there is increase in the rate as well as the force of contraction of the heart when you give the direct injection of histamine into the heart, right? So what it indicates? So increase in heart rate and force of contraction, it indicates that histamine, it stimulates cardiovascular system. Third, it is action on the visceral smooth muscle. Now, what do you mean by visceral smooth muscle? So, those smooth muscles which are present inside the body, it is called as visceral smooth muscle. So, what are those smooth muscles present inside the body? One, it is the bronchi, uterus, then intestine. So, these are the visceral smooth muscle which are present inside the body. Let's see what is their action. So, when histamine it is given in case of the lungs, when histamine reach to the lungs, maybe you are given the IV injection, and through IV injection histamine goes to the lungs, and where the lungs it produces the bronchoconstriction. So again it produces the stimulation of the bronchi, and it is responsible for the bronchoconstriction. Now, when any drug which produces the bronchoconstriction or any biological molecule, it produces the bronchoconstriction, you remember that in such cases, if patient also having the asthma, so the patient of the asthma, they are highly sensitive to the bronchoconstrictory action of the histamine. Now, what do you mean by this? Now, what happen in case of asthmatic patient? In case of asthmatic patient, already they are suffering from the bronchoconstriction. Now, these are the bronchi, right? So, when these bronchi are constricted, what will happen due to that? This space will be decreased. So, the space to accumulate or to accommodate the air will decrease, isn't it? So, this is commonly seen in case of asthmatic patient. Now, when you give the histamine, so already the patient bronchi, they are constricted. The space it is less due to the accumulation of the sputum, isn't it? Now, when you give the histamine also produces the bronchoconstriction. This bronchoconstriction, it will be more, and the condition of that patient become complicated, right? And even it is seen that asthmatic patient, it react more in presence of the histamine. It means it produces more bronchoconstriction as compared to the normal patient. So when you give the same dose of histamine to the both normal patient and as well as asthmatic patient, it is observed that the bronchoconstriction produced in asthmatic patient, it is more predominant as compared to the bronchoconstriction it is produced in case of the normal patient. So this clearly indicates that patient of the asthma, they are highly sensitive to the bronchoconstrictory action of the histamine. So this is action on the bronchi. So that you just remember it produces the bronchoconstriction. Now let's see what is the action on the intestine. So intestine, again it is another visceral smooth muscle. So on the intestine, at the larger dose, it increases the intestinal contraction. So there is no much effect in case of the smaller dose. At larger dose only it increases the intestinal contraction. Now what happened due to increase in intestinal contraction? So when there is much increase in intestinal contraction, patients suffer from abdominal cramp and the colic. That is the pain which is produced in the abdomen. It is called as the colic, and this is related to more constriction of the intestine. So this is again action on the intestine. So action on the bronchi, it produces the contraction. Action on the intestine, it produces contraction but at larger dose, not at a smaller dose. Okay, so this is the difference between the action of the bronchi and intestine. Let's study about another smooth muscle. So next smooth muscle which is present in our body, it is the uterus. So uterus, it is generally present in the female, not present in the male. So the study of uterus, it is done on different uterine preparation. So when the study was done on guinea pig uterus, it is observed that the guinea pig uterus, it is contracted. While the study was done on the rat uterus, it is observed that the rat uterus, it is relaxed. So instead of contraction, it produces the relaxation in the rat uterus. Whereas when study was done on the human uterus, it is observed that there is no much effect it is observed with the histamine. Now let's see why it is happening. That is, somewhere it produces uterine contraction, somewhere it produces the uterine relaxation, whereas in some uterus, why it does not produces much effect. Now to understand this, we must know which receptor it is responsible for contraction and which histaminergic receptor it is responsible for the relaxation. So the effect it is produced at different uterine preparation, it is depend upon which receptor it is predominantly present in that particular animal. For example, the guinea pig uterus, why it produces the contraction, in the rat uterus, why it is produces relaxation, and why in case of human uterus there is no much effect. Now let's see which receptor produces the contraction and which receptor it is responsible for the relaxation of this uterine preparation. So it is observed that smooth muscle contraction, it is related to H1 response. It means it is related to H1 histaminergic receptor, whereas the H2 receptor, it is responsible for the relaxation. So here I am not only talking about the uterus, I am talking about all smooth muscle, including the bronchi, intestine, as well as uterus, right? So if the H1 receptor, if they are predominantly present, now what will happen if they are predominantly present? It will produce as the contraction. Now why guinea pig uterus it is contracted? Because in guinea pig ileum, H1 receptor are predominantly present. It means more H1 receptor present, no H2 receptor are present. Since there is more H1 receptor are present, guinea pig ileum it produces the contraction. Likewise, the rat uterus it produces the relaxation, because in case of the rat, the predominant H present it is H2. And when histamine bind to the H2 receptor, what it produces? It produces a relaxation. Whereas in case of human uterus, there are negligible number of histaminergic receptor are present. Since there is negligible number of histaminergic receptor present, it does not produces much effect on human uterus, right? So this is we have seen with reference to the uterus. Now let's quickly see what is the action on the bronchi. Bronchi it produces the contraction. Now you guess which receptor are predominantly present in the bronchi? Since it produces the contraction, the receptor predominantly present in the bronchi are the H1 receptor, isn't it? Whereas in case of the intestine, what it produces the contraction. So the contraction it is related again to the H1 response, isn't it? So depending upon which receptor are predominantly present in the smooth muscle, it produces either contraction or relaxation of the muscle. So we have seen the pharmacological action on the visceral smooth muscle, blood vessel and cardiovascular system. So next pharmacological action, it is the action on the gland. Now we will be talking about especially the GIT, so that is gastrointestinal tract. So the action on the gastrointestinal tract of the histamine, it is generally mediated through H2 receptor, and specifically it is mediated through activation of hydrogen potassium ATPase pump. Okay, so after action on the H2 receptor, so first the histamine bind to the H2 receptor, and after binding of histamine to the H2 receptor, it produces activation of hydrogen potassium ATPase pump. Now due to activation of this hydrogen potassium ATPase pump, what happen in case of your gastrointestinal tract? It produces marked increase in a gastric secretion. So there will be increase in a gastric secretion, especially of the acids, that is the HCl and the pepsin. So there is increase in level of gastric secretion, that is acid and pepsin. It is seen when histamine it activate H2 receptor and due to activation of hydrogen potassium ATPase pump. So in all pharmacological action of the histamine, what you must remember is you must remember which histaminergic receptor it is responsible for pharmacological action. So just, for example, we have seen in case of visceral smooth muscle, most of the visceral smooth muscle it produces the contraction, so it is mediated by H1 receptor, right? Whereas in case of uterus, somewhere it produces contraction, somewhere it produces relaxation, H2 receptor. Likewise, you must remember in case of the gland like GIT. So what do you mean by gland? So gland it is the tissue which can secrete the hormone or which can secrete the biological fluid. So any cell which having ability to secrete the hormone or which has ability to secrete the biological fluid, it is called as a gland. Now your intestine it is a gland because what it does, it produces the secretion of digestive juices. It produces the secretion of HCl, that is hydrochloric acid, isn't it? It produces the secretion of the pepsin. Since these biological fluids are secreted by your gastric cell, GIT cell, it is also called as a gland. So the action on the gland it is mediated by the H2 receptor and it is due to activation of hydrogen potassium ATPase pump. Next we will see about the action on the sensory nerve ending. So what is the responsibility of sensory nerve ending? What sensory nerve ending does? So sensory nerve ending, they are responsible for carrying the sensation, isn't it? It conducts the impulses for the pain sensation, and there are different type of pain sensations are there, like itching is there, tingling sensation is there, deep pain is there, right? So all these pain sensation, it is carried by the sensory nerve ending, right? So they carry this message from the sensory organ to the brain. So let's see what is the effect of the histamine on the sensory nerve ending. So there are different type of pain sensation as I have mentioned. So the itching, it is one of the pain sensation which is generally seen in case of the allergy. It produces the urticaria, cardia and the itching. So it is seen that the histamine, when you give the injection through IV route or intracutaneous route. So intracutaneous means you are giving inside the skin. So either IV route or intracutaneous route, when you give the injection of the histamine, it produces the itching, okay? Whereas when you give the deep injection of the histamine, right, and at higher concentration, so when higher concentration of histamine injected more deeply, what it does, it produces the deep pain, it produces the severe deep pain in that particular pain. So the high concentration when injected more deeply, it causes the deep pain. What it indicate, or it indicate capacity of histamine to stimulate nerve ending. Likewise, it also having the effect on autonomic ganglia and adrenal medulla, and when it reach to the autonomic ganglia and adrenal medulla, it produces the stimulation. So it produces the stimulation of autonomic ganglia, it produces the stimulation of adrenal medulla, and when it stimulates adrenal medulla, what it does, it produces release of the adrenaline. So stimulation of adrenal medulla, it produces release of the adrenaline. And what happens when adrenaline it is released? Which organ? It produces the action on cardiovascular system, and adrenaline produces increase in heart rate and force of contraction. And what is the result of this? It produces, due to increase in heart rate and force of contraction, there is secondary rise in a blood pressure. Let's see what is the effect of histamine on central nervous system, that is CNS. So remember that in order to produce action on central nervous system, drug must penetrate blood-brain barrier. If any drug or if any biological molecule, if it penetrates blood-brain barrier, then only it has ability to produce the action on central nervous system, isn't it? Otherwise, it won't produce action on the central nervous system unless you directly give injection into the CNS. So as far as the effect on the CNS is concerned, histamine, since it does not penetrate blood-brain barrier, there is no central effect on IV injection. So on IV injection, histamine does not produce any central effect. Why? Because it does not penetrate blood-brain barrier, right? So now if you want to study their action on the CNS, then what you need to do, you need to give intracerebroventricular injection of the histamine. So you are giving injection specially into the CSF. What is the CSF? CSF, it is the cerebrospinal fluid, okay? So when you give injection directly into cerebrospinal fluid, the histamine will reach into the CNS and it starts showing different actions. So what are their actions? It produces the rise in the blood pressure. So rise in the blood pressure which is produced due to the histamine, it is due to their action on vasomotor center. It produces the stimulation of vasomotor center. It produces the stimulation of cardiac center, which is responsible for rise in the blood pressure. It produces this effect on the cardiovascular system. In addition, it produces behavioral arousal. So behavioral arousal, it is produced especially due to the stimulation of the part of the brain which control the human behavior, isn't it? Since it stimulates that part of the brain, it produces behavioral arousal. It produces the hypothermia. So action, it is due to the action on thermoregulatory center. Since it produces the hypothermia, what it indicates that it inhibits thermoregulatory center, or it produces depression of thermoregulatory center. Due to that, it produces hypothermia. It produces the vomiting and ADH release, antidiuretic hormone release. So what will happen due to increase in level of antidiuretic hormone? So when there is increase in level of antidiuretic hormone, it will reduce urinary output, isn't it? So it controls the urinary output. So all these effects are mediated partly by H1 receptor and partly by the H2 receptor. So the action on the central nervous system, it is mediated partly by both H1 as well as H2 receptor. Now let's see what is the pathophysiological role of the histamine. So patho means it is a disease, and how histamine change the physiology which is responsible for producing the disease, okay, and how we can modulate that to overcome the symptom of that particular disease. So that we will be learning in this particular section. So let's see the first action, that is the action on the gastric secretion. So we have already seen in case of gastric secretion, histamine has dominant physiological role, especially in H2 receptor, right? H2 receptor mediated activation of hydrogen potassium ATPase pump. It is responsible for more secretion of acid as well as pepsin. So more secretion of the acid, it produces hyperchlorhydria, or it produces the hyperacidity. In the common term, you call it as the hyperacidity. Now, since activation of H2 receptor, it produces the hyperacidity. Now, if you can block this H2 receptor, right, what will happen? There will be the suppression of acid secretion, isn't it? And H2 blocker can be used for the treatment of hyperacidity. So many formulation, many drugs are there in market, like Rentec D contain the ranitidine, Zintac, it can also contain ranitidine. So ranitidine, cimetidine, these are the drugs which what they call they produces the blockage of H2 receptor. If H2 receptor it is blocked, what will happen? There is no activation of hydrogen potassium ATPase pump. It will control release of the HCl, and since release of HCl it is controlled, this drug produces very good effect, especially in case of hyper secretion of the acid, in case of hyperacidity. So this is the effect on the gastric secretion. Next, in case of the allergy, so histamine, it is the great mediator of the allergic reaction, right? It produces the allergy, and especially it mediate immediate type of hypersensitivity reaction. So there are different type of hypersensitivity reaction, like immediate and delay hypersensitivity reaction, isn't it? So out of this, it mediate immediate type of hypersensitivity. Different symptom, like it produces the urticaria, that is the red skin and itching. It produces the angioedema, where there is inflammation of the blood vessel, it is seen. It produces the bronchoconstriction, contraction of the bronchi. It also produces the anaphylactic shock. So the release of the histamine, it produces all these allergic symptoms in that particular patient, and it is immediate type, means immediately the patient starts showing all these symptoms, right? Now these all symptoms are mediated by H1 receptor. So since these symptoms are mediated by H1 receptor, you can make use of H1 antagonist, the drug which can block H1 receptor for the treatment of the allergy. So nowadays, most of the drugs which are available in the market for the treatment of the allergy are H1 antagonist in nature, isn't it? So they are mostly H1 antagonist in nature, because if you give H1 antagonist, it can effectively block urticaria, angioedema, bronchoconstriction and anaphylactic shock. Third one, the effect on the transmitter. So we have seen it act as a efferent transmitter. It initiates the sensation of itch and pain at sensory nerve endings, and receptor responsible for this, it is the H1 receptor. So if you can give H1 receptor antagonist, you can see it can act as anti-allergic. In addition to that, it can also reduce the itching as well as pain sensation. Likewise, they are also the mediator of the inflammation. It implicates as a mediator of vasodilation and inflammation. So if you can give antihistaminic drug can effectively reduce the inflammation, especially in case of the smooth muscle like the bronchia, and it is very useful for the treatment of the asthma. Okay. Next, the effect on the tissue growth and the repair. What histamine does, it plays an essential role in the process of growth as well as repair, and it also produces effect on the headache. What it does, in case of the headache, the effect, it is due to their effect on the blood vessel, right? It produces the dilatation of the blood vessel, but it is implicated in only certain vascular headache. There is no conclusive evidences. Since there is no conclusive evidences, you are not using the histaminergic antagonist for the treatment of any type of the headache. So this is all about pathological role of the histamine, what role it play in different type of the disease and how we can control it, isn't it? So to control it, we can have two category of the drug. One, it is H1 antagonist, and second one, it is H2 antagonist. So let's see the classification of first category, that is H1 antagonist. So H1 antagonist, they are classified broadly into two categories. One, it is conventional H1 antihistaminic drug or H1 antagonist drug. So conventional H1 antagonists are those drugs which having the CNS effect. So very easy to remember. And second category, it is the second generation antihistaminic drug. These are the drug which does not having CNS effect. So this is how you can classify it between conventional and second generation antihistaminic. Okay, so to revise, conventional antihistaminic are those drugs which having central nervous system effect, it produces the sedation in the CNS, right? Second generation antihistaminic are those drugs which does not having CNS effect, right? And based on CNS inhibition, the conventional antihistaminic drug are classified into three categories. One, it is the highly sedative, example diphenhydramines and promethazine. Second category, it is moderately sedative, example it is phenarmine, cyproheptadine and cinnarizine. Third category, it is the mild sedative, example chlorpheniramine, dexchlorpheniramine and dimethindine. Okay, so most of these conventional antihistaminics, since it having CNS effect, it produces different degree of inhibition of central nervous system, and these are seen in many cough preparation. Diphenhydramine present in many cough preparations, or in case of the tablet of the cold and the flu, you are using diphenhydramine. So if there is runny nose or the feeling of the due to the allergy, that can be easily controlled by the diphenhydramine, right? So most of these drugs are used for the treatment of the allergy. Likewise, second generation antihistaminic, example fexofenadine and cetirizine, these are the drugs also having anti-allergic action. But what is the advantage? Since it does not crosses the blood-brain barrier or having the less ability to cross the blood-brain barrier, it having less or no effect on the central nervous system. So this disadvantage of inhibition of the CNS, so generally it affect the day-to-day functioning of the patient. This can be easily prevented if you use the cetirizine. So cetirizine, again, well-known marketed formulation, that is cetirizine, is available in market. It is highly sell anti-allergic drugs. It is also used for the in case of some cough preparation, and also for the common cold and cough, isn't it? So these are all H1 and antagonistic drug. So I have done with my session. So thanks for watching. If you like my session, then do remember to give me a thumbs up.